Hi everybody, this is Kevin with Garrison Dental Solutions, and we are here today with the esteemed Dr. J.D. Corey.
Oh man.
Yeah, no pressure there. No pressure there. And Dr. Corey has helped us along through the process of developing the new Fusion Anterior Matrix System. So Dr. Corey, this is a case that you sent in. I mean, that the ink couldn't have dried on the new kit yet. And you had sent this case in already.
Right.
And so why don't you talk us through it a little bit? I mean, it looks like maybe the patient was a little older.
Yeah. Yep. I'm not exactly sure as to what happened in this situation. And if I recall, she chipped the tooth when she was younger. They repaired it. It kept breaking. Okay. Repaired it, kept breaking. And then, just wasn't having a whole lot of success with it. This was prior to aligners. So we did aligners on this patient. But we told the patient we were going to wait until the end of her aligner treatment to fix this tooth so she wouldn't, just chip it off. And that way we can make sure everything is nice and even and symmetrical. And she had ortho when she was younger, and you could see she's missing a tooth here. She's missing one of her central incisors. But anyways, so that was the situation here. Now that we have her all lined up correctly, the teeth look good, we want to fix this tooth for her so that she has the great smile that she wants. I had been using this anterior system for, just a few days probably, and it was going so well for the maxillary restorations that I tried that I wanted to try to incorporate this into lengthening this tooth for her. Because when we lengthen these teeth, it's not just like a mesial or a distal, it's basically all, mesial, incisal, facial, lingual, distal, and sometimes that can be a little tricky to do.
You got 5 surfaces.
Right, yeah, we're playing with everything. And so initially I put a matrix band in because in my mind I was thinking, okay, I need to restore the mesial first or the distal first. And then once I get that taken care of, I'm going to restore the other side, because that's the way I had done it in the past with the clear strips, because I had found that it was just kind of a hassle to try to restore both sides at once by wrapping the band around the tooth. And
like a mylar strip.
Yeah, exactly. So, but once I put that in, I just thought maybe I can overlap this and put a second band on here, help contour both sides at the same time, and that's what I ended up doing. And so you could see this would not work if the tooth was so skinny that this band, unless you trimmed it, I guess. That's probably what I would do. I would just trim that band and then it would still work. But these are just 2 bands, and you can really see the curvature of these bands in this photo, I think, which is really nice. You can also see how well they're tucking into the sulcus here. Now,
that's the first thing I noticed when you sent us this. Is like, boy, those they
tuck right in. They do. And for this, I didn't necessarily need a great seal down here, but anytime you can get that, that's what you want, especially for your restorations where you're prepping down here. But for this one, I had 2 matrices at the same time. So what I would do for this situation is I would take my thumb and I would put a lot of pressure on the lingual of this tooth, really pushing these bands up against the lingual surface of the tooth. And then I would inject the composite, and all I have to worry about in this situation is really the incisal edge and the facial, because my mesial surface is going to be taken care of, my distal surface is going to be taken care of, my incisal I can get to, so I can shape that with my instrument. The lingual is going to be taken care of with the matrix bands. There may be just a little lip here that I got to smooth out, but minor. This is with minimal shaping with a burr after adding that composite in there.
Well, I think what really strikes me about this picture is how, even though the interproximal shape, the emergence profile is radically different on both sides.
Right.
Both sides came out exact.
Yep. An
exact match.
This was, in my opinion, easier for me to do well, if that makes sense. Sure. Anybody can put composite there and then go back and shape it and trim it and everything else and eventually get where you're going. But this made it simpler and just better of a workflow for me. Sure. So I think if people are doing these kind of treatments where you're lengthening these lower incisors, or you're doing aligners and you're trying to fix a little bit of wear pattern at the end, I think you should try it, because I'm telling you, it made my life a lot easier when it comes to restoring these type of teeth. For these mandibular anteriors, sometimes these teeth are so small, we don't really go to veneers or crowns for them. And we do direct restorations to build these up in composite, and they can be predictable, and this is, I think, helping to achieve that.